Hello, I am urologist Omer Erdamakaya. Today, I will make a short video presentation about hematospermia, that is, bleeding in the semen and what causes it. Bleeding in the semen can often be confused with bleeding or leakage from the penis after sexual intercourse. The two are different from each other. There may be bleeding from time to time after sexual intercourse. When the patient wipes his penis on a napkin, he can see blood. Conditions such as blood leakage usually occur after compulsive intercourse, dry vagina sex, or hard intercourse positions. Traumatizing the penis, getting a blow to the penis, hitting the urinary tract is actually a situation that develops without realizing it. Bleeding in the semen is a condition that occurs when the semen is brown. Patients may come to us in a panic when they see blood in the semen. Bad things come to mind right away. But most of the time it is not a sign of a bad disease. Very rarely it can be counted as a sign of bad disease. What are the most common causes? The most common reasons we see are the patient's use of blood thinners, a blood disease that will cause bleeding disorders, sexually transmitted infections, trauma, jumping from a height and falling, lifting something heavy, and sudden movements. To be honest, 70% of time, cause of hematospermia cannot be found. It takes a few months when it starts. The reason for this is the bleeding of the prostate or a small vessel, the formation of blood collection, and the browning of the semen over time. The blood in the semen is discharged in pieces within months. That's why it can take months. In such cases, you should not panic. Some chronic diseases can lead to the development of this condition. For example, since the infection is more common in diabetes, blood may appear in the semen more in these patients. The situation may take longer. It is the same for patients using blood thinners. However, it can very rarely be a symptom of testicular cancer or prostate cancer. In such cases, it is absolutely necessary to go to a urologist. You shouldn't panic. When a urologist is visited, the urinary tract is evaluated radiologically, urinalysis and blood analysis are performed. After the conditions such as prostate cancer and testicular cancer are ruled out, the patient is given a simple medical treatment and we can say that 95% of the patients return to their normal state within a few months. As a result, hematospermia, bloody semen, is a condition that does not cause trouble, but it must be checked by a doctor. Thanks for listening, best regards.